today is the word in the clinic. Hey, Brandon, thanks for watching. Sorry, running a little late as usual, but today the word in the clinic is, hey, Melanie, reflux. What is reflux, you might say? Most of you might know, but we're continuing our series for babies for this month. I just kind of wanted to start, hey, Linda, kind of covering one topic, main topic that I'm seeing in the clinic for the week. So we have a lot of babies right now in the practice, new, cuddly, cute babies. And so I'm getting a lot of parents asking me a lot of things that are typical for babies, and they're worried, and these things are very common, but I wanted to share them with you as well, the same things I tell them all the time. So the word in the clinic is reflux, like I said. And reflux, hi Peter, reflux is spit up. You know, the layman's term is spit up. When things come up from the stomach, out through the nose or mouth, up through the esophagus and out through the nose or mouth. Most people say that's the baby spitting up or the baby's vomiting. And the technical word is reflux, okay? So when do you worry about that? So some babies are more spitty than others. Some babies don't spit up at all, and some spit up a lot. And it is a worrisome thing for parents because, number one, we don't like it. It's a little stinky, a little slimy, and messes up their clothes. And we worry that something is wrong with the baby or they're not getting enough nutrients, not getting enough of their formula. So it's a very common complaint for doctors that parents complain about the baby spitting up a lot. And that's what I've been getting a lot of this week with the new babies. So the way we think about this as pediatricians is there is physiologic reflux, and then there's pathologic reflux. So physiologic reflux, we don't worry about too much. We call that typical or normal. And it has to do with the structure of a baby's lower esophageal sphincter. The doorway from the stomach to the esophagus is loose. It's a little bit open. It's not tight like adults are. As you grow, it tightens on its own and it doesn't let things out. So it's very hard for an adult to vomit, right? Because that sphincter's tight. It takes a lot of force to get things back up. But for babies, that's very easy because that sphincter is loose. So we have babies that spit up more than others because their sphincter is just loose. And when they lay down or if they wet burp or they burp, it's easy for that milk to just come on back up. So it doesn't usually cause them much trouble, right? So we accept this type of spit up, okay? And it gets better with time as the baby matures, as that sphincter begins to tighten up, we see less and less of it. And by the time the kid is 9 to 10 months old, or even sometimes after 6 months or so, we don't hardly see that anymore, okay? Now, pathologic reflux is a problem. We worry. These are the kids that they reflux so much, they spit up or vomit so much, they may shoot across the room, or it's all of their milk, or it's every feed. The baby may have trouble breathing or choking, or turning colors, and the baby may not be growing. So if your baby spits up like that, that's a problem, and you definitely want to talk to the doctor. And as they check their growth and their weight and look at their growth chart, they may see that your baby is not gaining weight like they should. That is a problem, okay? So let's break it down. If you have physiologic reflux, just spit up and the baby's growing well, their weight is great, they look good on the growth chart, they're not having any trouble with breathing problems when they're spitting up, they're just a happy spitter, as we say, we don't worry about that, okay? But if they are doing some of the other things, those worrisome things I just mentioned, then definitely the doctor will need to intervene, okay? So let's talk about reflux precautions, what you do about it, all right? For any baby, whether it's pathologic or within normal type of spitting up, there's some things you can do to make it less, okay? And this is all about gravity, promoting that formula, that milk to go down, go into the stomach, stay in the stomach, and move on through, right? And be digested instead of coming back up. So gravity helps you a lot. So you want to keep the baby in an upright position, 45 degrees or higher. And you want to, while you're feeding them and a little bit after. So a lot of people will feed the baby flat. No, no. A lot of people will, as soon as they finish the bottle, lay the baby down. No, no. Some people don't burp the baby. As babies get older, they don't burp as much. That may be a problem for babies who are spitting up a lot. So you want to burp frequently. You want to keep them at an upright angle, and you want to keep them up longer and don't lay them down right away. All of that lets gravity be on your side and help things stay down and go on through. Okay. Next, you don't want to overfeed the baby. So probably the most common cause of baby spitting up and vomiting is, outside of being sick or having a problem, is overfeeding. You know, we oftentimes will think that a baby wants more because they're crying. Crying does not always mean hunger. And so we end up increasing the amount we give them, or we end up feeding them too frequently and they spit it up. Their stomachs are about the size of their fists. That's pretty small. And so it's not going to hold a lot. So sometimes I have a 2-month baby and the mom's already telling me she's giving them 6 ounces because they cry too much and she really wants to fill them up. That's coming up because that baby can't hold that in their stomach. As soon as they wiggle or burp or cry, the force just pushes it right up through that loose sphincter and it's coming up. So don't overfeed your baby, okay? So positioning and not overfeeding and giving them the right volume is what we call reflux precautions, and that will lessen the reflux, okay? All right, so also feeding smaller amounts more frequently for some babies work. So your baby can take 4 ounces because they're 4 months or so old, but they spit up. So we may decrease the feed to 3 ounces and just say feed them more frequently. So you can feed them every 2 hours instead of trying to stretch 3 to 4 hours. And that may be the magic way to keep it down and lessen their spit up. Okay. Now for pathologic cases, the doctor may need to send the baby to a gastroenterology specialist to figure out if there's something more serious going on. We also have reflux formulas called AR that are thickened and help to keep the formula in the stomach. And then some old school docs or people will thicken the formula with rice cereal. I don't recommend that as much because it adds calories to the feed and we end up doing it every bottle, and that may be, too many calories and the baby may get a little fat on us, okay? Gain too much weight. So there are formulas that are thickened without adding calories that you can use for reflux. So just the point here is just talk to your pediatrician about that if it's needed. And also there's medications that may help, but usually those are given by a specialist. Okay. So I never want to keep this too long, but definitely when babies spit up, it can be worrisome and a nuisance. But just know when to worry. Not all reflux is something to worry about, and know what to do about it to make it less. And we discussed that today in our talk. So thank you guys so much for listening. This has been The Word in the Clinic, and we'll talk next week. All right. Take care. Have a great weekend.